Today I'm going to talk about mania and a herbal combination that we use in Chinese medicine, longu plus mu li. And we talk about mania in Western medicine and in general psychiatric disorders somewhat separately than we do from organic medical conditions or things that we find metabolic problems and cures for. So, for example, if somebody comes in with a psychiatric disorder or a manic episode, we might look for things that can cause that from an organic standpoint, like thyroid problems or liver disease or central nervous system infections. There could be a number of things that we find based on uh, biochemical labs or radio imaging that can cause a psychiatric symptom. But if we don't find those things, then we tend to classify the psychiatric disorder as a separate, just psychiatric disorder. But in Chinese medicine, we think about psychiatric disorders as completely intertwined with the body and with the health of the organs and the health of the whole person. And so a lot of times in Chinese medicine, psychiatric symptoms can be caused by problems related to the heart organ, to the liver organ, to the kidney organ. Those are kind of the three main ones. But in any organ system that goes wrong can result with psychiatric problems or symptoms. And so when you talk about mania in Western medicine, we really classify it by a few characteristic types of symptoms. Usually the person's going to have a lot of increased energy. They're going to have irritability, restlessness. They may go through the night without sleeping. They may have a sense of euphoria, feeling able to accomplish a lot of things. Person might spend a lot of money very quickly in a short amount of time because of that sense of racing thoughts and wanting to accomplish things and confidence. And and those are some of the symptoms of a manic episode. And in Chinese medicine, a lot of times, but not all times, a lot of times this can be caused um, by a disturbance in the yang energy of the heart or of the liver, and it causing to rise up, to flare up, and to cause these unpredictable behavioral patterns. And so there's a combination, Longu and Mu Li, which is two very um, well-known herbs in the Chinese medical literature individually, and then also as a combination. And they both act on the liver and kidneys and also the heart to help calm down the heart, to help to what we call quiet the spirit, calm the heart, and sedate the liver yang energy. Now, both of these substances are mineral substances, and they have a heavy quality, salty quality, and ability to settle the spirit. And so they work in combination to help calm down an individual who may be having a a manic episode from these conditions of liver yang rising, insufficient liver yin, the heart spirit being unsettled. Now, those things can happen for a number of reasons. So, in our clinic, when we are treating these types of symptoms, we look to see what is the whole picture look like? What else underlying problems do they have? Do they have deficiency of liver and kidney in, or do they have a heat pattern with excess that needs to be treated as well? So it's not just taking these herbs. If you go to a Western doctor and they diagnose you with mania or bipolar disorder, you can't just go home and buy these herbs and take it. You have to really take it if the condition matches the presentation from a Chinese medicine standpoint as well. So we really have to investigate how your organ systems are functioning, um, and and evaluate your tongue, your pulse, look at see what the whole condition of your body is before we decide which herbs to use. And usually these herbs are going to be part of a combination with other herbs um, to treat the whole thing and not just mask the symptoms. So uh, that's a little bit about how we think about mania, bipolar disorder, and Chinese medicine, and how herbs like Longu and Muli can be used to help in that situation. So if this is something that you're interested in learning more about for treatment, you can reach out to us and visit us at houstonacupuncture.com, and we'll see you next time.